Hi, I'm Marcia Castro. I'm the Andelot Professor of Demography at the Harvard T.H. School of Public Health. I direct one of the departments here in the school, Department of Global Health and Population, and I also serve as director of the Brazil Studies program at Harvard. I want to tell you a little bit about the health system in Brazil. It's called SUS. It's a universal, unified, comprehensive health system. In 1988, when Brazil issued a new constitution, as it was coming out of a military government, health was established as a right. Few countries have health as a right written in the constitution. Brazil is one of them. 2 years later, all the legal action to really create the SUS was established. SUS just completed 35 years last year. And the health system is pretty much available to anyone, anywhere in the country. It's comprehensive in the sense that it has a community-based primary care that is very well established. It has secondary care, it has hospitalizations, it created the largest network of transplants in the world. It has a network of milk banks that really makes a difference for children that are born premature or whose mothers die at delivery. It controls all the surveillance of water and food that is distributed in the country. It has an emergency response that acts daily, very different than the US. If you need an ambulance here, you're going to pay a lot. In Brazil, this is all for free. But it also has what is called a national force that acts during emergencies. And this became very visible recently when we had floods in the south of the country. And a few years ago when 2 dams collapsed in the state of Minas Gerais. Those are the people that come and act. And usually they come when the local capacities to respond are not enough. The primary care is community-based, so Brazil has a large network of community health agents. They live in the community, they know the community, and they provide the comprehensive care with home visits, following up families with a particular focus on children, pregnant women, and the elderly. A few things are important to understand about the SUS. No other country with more than 100 million people have a universal, free of charge health system. Brazil is unique on that. The second thing is this health system was created from a popular movement. So you have to understand what was going on in the country, coming out of the military government, having a new constitution, democracy is brand new. That created the momentum for the basis of the SUS to be developed and then taken up by the government, and that's how the SUS came about. And the third thing that is important to remember is that before the SUS, only people that had formal jobs had access to health care. Unemployed, people in the informal market, they had nothing. They had no health care. I like to see the SUS as one of the most important mechanisms of reduction of inequality in health that Brazil has. It has been instrumental to reduce infant mortality. It has reduced inequities in access to services and also inequities in mortality. It's also important to mention that the SUS has challenges, as you can imagine. One of them is underfunding, and this has been a structural challenge since the SUS was created. Also, there is a private health sector in Brazil. This duality, public and private, exists since the creation of the SUS. And one of the imbalances is that when you look at the money spent on health, there is an imbalance on how much is spent in the private sector and how much is spent in the public sector. So there is still a lot to be done in order to improve the system, to make it more resilient to crisis, to improve financing. But the option of not having the SUS is just not something that can and should be considered, because 75% of the Brazilian population relies uniquely in this health system.